From happily married towards unhappy relationship. Some of the reason can be sexual dysfunction. Sexual challenges can be difficult to maneuver. These conditions are often considered private affairs, making their management incredibly isolating. Despite the perceived challenges of living with sexual dysfunction, these conditions are manageable and may even be treated with right care. Sexual dysfunctions. It is a problem that can happen during any phase of the sexual response cycle. Sexual response cycle traditionally includes excitement, plateau, orgasm, and resolution. Sexual dysfunction prevents you from experiencing satisfaction from sexual activity. We'll see each type in detail. Types: sexual desire disorders, arousal disorders, orgasm challenges, pain during intercourse. First is sexual desire disorder. It is a lack of sexual desire or interest in sex. It is also known as libido disorder or low libido. Hypoactive sexual desire disorder. This condition is marked by a persistent lack of interest in sexual activities. It is the absence of or reduction in sexual thoughts and fantasies. Sexual aversion disorder. There are cases where the mere thought of engaging in sexual activities can cause an almost physical recoil in disgust. Sexual aversion disorder is the persistent and sometimes extreme avoidance of all or most forms of genital contact with a partner. Arousal disorders. It is the inability to become physically aroused or excited during sexual activity. Erectile dysfunction. This condition may be considered an arousal disorder where men experience difficulty with forming and sustaining erections suitable for sexual activity. Lack of vaginal lubrication. Vaginal dryness is a condition that can affect women of different ages. The absence of proper lubrication despite sexual excitement can cause pain and difficulties in intimate moments. Persistent genital arousal disorder. People living with this condition experience unwanted stimulation at work, in school, other public places, and even at home alone with no warning or trigger. These spontaneous and intrusive feelings may or may not produce orgasms and can be incredibly distressing to those living with them. Orgasm disorder. It is a delay or absence of orgasm. Premature ejaculation. This can occur before or during penetration. A person living with this condition usually has no control over the timing of their ejaculation. Delayed ejaculation. It refers to an unusually long wait time for achieving orgasm during intercourse. Orgasmic dysfunction. It may be the absence of orgasm following sexual activity, reduced intensity of orgasm despite adequate stimulation, or a noticeable delay in reaching orgasm. Anejaculation. The absence of ejaculate during orgasm. Pain disorder. It is a pain during intercourse. Dyspareunia. Experience continuous pain during sex or when attempts are made to initiate penis-vaginal intercourse. Vaginismus. Here, all forms of vaginal entry, whether penile or through the fingers and sexual objects, are met with difficulty. This occurs despite a genuine desire to engage in sex. Symptoms in men: an unexplainable lack of interest in sexual intercourse, persistent difficulty in producing or maintaining an erection suitable for sex, the inability to reach orgasm, or a lengthened delay in climaxing. Then, constant difficulty with regulating moments when ejaculation occurs. Symptoms in women: a noticeable disinterest in sexual activity, difficulty getting aroused, experiencing pain during intercourse, inadequate lubrication during sex, difficulty relaxing vaginal muscles to permit penetration. Causes: physical causes. These conditions include diabetes, heart and vascular disease, neurological disorders, chronic diseases such as kidney or liver failure, and alcoholism and drug abuse. Side effects of medications. These include some antidepressant drugs that can affect sexual function. Hormonal imbalances. Low testosterone has been linked to low libido in men. Likewise, corresponding effects may be seen in women with low estrogen. Psychological causes. These include work-related stress and anxiety, concern about sexual performance, marital or relationship problems, depression, feelings of guilt, concern about body image, and the effects of a past sexual trauma. Diagnosis. The doctor will start with a complete past history of symptoms and a physical condition. If needed, doctor may suggest diagnostic test to check out any medical issues which may cause sexual dysfunction. That is, diagnostic tests are to rule out medical problems that may be contributing to the dysfunction. Evaluation. Evaluation of attitudes about sex as well as other possible contributing factors: fear, anxiety, past sexual trauma, abuse, relationship concerns, medications, alcohol or drug abuse, etc. are evaluated, and it helps a clinician understand the underlying causes of the problem, and the doctor will be able to recommend the right treatment. Management. Most types of sexual dysfunction can be addressed by treating the underlying physical or psychological problems. Medications. Certain drugs and supplements can help to improve sexual function in men and women, helping to improve blood flow to the penis. They help to boost erectile function and stamina during intercourse. Hormonal supplements such as testosterone and estrogen may also help to mediate difficulties associated with hormonal imbalances. Mechanical aids. Aids such as vacuum devices and penile implants may help men with erectile dysfunction. Dilators may help women who experience narrowing of the vagina. Sex therapy. Sex therapists can address people experiencing sexual problems that cannot be addressed by their primary clinician. Therapists are often good marital counselors too. Behavioral treatments. These involve various techniques including insight into harmful behavior in the relationship or techniques such as self-stimulation for treatment of problems with arousal and orgasm. Psychotherapy. Therapy with a trained counselor can help you address sexual trauma from the past, feelings of anxiety, fear, guilt, and poor body image. Education and communication. Education about sex and sexual behavior and responses may help you overcome anxieties about sexual function. Open dialogue with your partner about your needs and concerns also helps overcome many barriers to a healthy sex life. So, this is all about the sexual dysfunctions. Please subscribe the channel for more videos on related topic. Thank you and keep smiling.